let's talk about the hangover effect from Super Bowl Sunday. So Mondays in emergency departments all around the country, including all around the world, are typically very, very busy. I don't know exactly what it is, but I'm sure it's got something to do with the fact that people don't want to come into the hospital on the weekend, and they kind of put off that visit to the emergency department until Monday. So as a result, we get slammed on Mondays. And the day after the Super Bowl is crazy, and this year was no exception. We saw a ton of patients, and I think within the first 2 hours of my shift, I saw 9 patients during our rapid assessment time. So this brings up some issues with wait times in the emergency department, and I got yelled at by a patient who was very upset about how long he had to wait. When patients come to the emergency department, despite what you might think, there is no line. We have a triage system that determines the severity of your illness. So when you come to the emergency department, you will get triaged into one of 5 levels. So 1, 2, 3, 4, 5. 1, you're not walking in. You're being brought in by an ambulance and you're about to die. We need to do something immediately. 2 are immediate life threats, things like chest pain, severe shortness of breath, or very abnormal vital signs like hypoxia, or someone who has suicidal ideation. 3 is where most people sit, and these are folks who have something that could be particularly painful, or something that is a life threat that we need to manage relatively quickly. And then you have level 4s, which are non-life threats, and they could be seen when we're able to get to you. And then 5s, that doesn't really happen that often. So in our department on Monday after Super Bowl, we had a really challenging mix where we had probably 20 people in our waiting room. Half of those were 3s and half of those were 4s. So obviously we need to be seeing the 3s as much as we can before the. So this meant that a lot of our 3s were being seen within about an hour, and a lot of the 4s, they were at the wait times of an hour and a half to 2 hours. So it can be really challenging if you're sitting in the waiting room and you're a 4 and you're seeing people being taken back ahead of you, and you can feel like you're getting jumped in the line. Well, the reality is those people need something different, and they need to be evaluated and have their investigation started a little quicker. So I know that can be really challenging for people, especially when you're having to wait. But the reality is that we have to do what's best for the group of patients that are in the emergency department at any one time, and seeing people who are sicker quicker is the most important thing to do and the right way to do it. So I'm just going to apologize in advance if you have to wait in the emergency room. In our waiting room, we are doing everything we possibly can to see you as quickly as we can, but we have to do it the right way so that we don't have bad outcomes for people, including you.